Hey everyone, it's Dr. Jin and welcome back to my channel. Today we're going to talk about a very common topic, something that affects millions of people out there and myself included. The topic is going to be about hyperpigmentation. Today we're going to do a deep dive into what is hyperpigmentation, what are the causes, how do we treat it, and how do we prevent it. So stay tuned. First, let's define hyperpigmentation. Basically what it is when you have spots on your skin that appear darker than the surrounding areas. And a lot of times it's due to the melanocytes, or those basic cells in your skin that produce the pigmentation. Sometimes they're overproductive, making too much color, and in essence what we end up with are certain spots that look darker than other areas of the skin. Now that we've defined hyperpigmentation, let's break it down into the three most common types that we see today. The first and probably the most common type of hyperpigmentation that affects each and every one of us are sunspots. Basically, what is it? We spent way too much time out in the sun, and basically the UV light and the rays have activated the melanocytes, or those cells in our skin, and they're basically reacting to it and creating too much pigment. Second type of hyperpigmentation would be melasma. This is a kind of a chronic condition where you have an imbalance in terms of the regulation of those melanocytes, where again, they're overactive. They're producing too much pigment, causing just a chronic overproduction of pigment. This is probably one of the most difficult conditions to treat. Lastly would be post-inflammatory hyperpigmentation. Commonly what we see when we get procedures done on our face or our skin, and there's a type of energy that's delivered to the skin like a laser. So say for instance you get a lasering procedure, whatever it is, and you get rid of all these sunspots and your skin looks great, right? The spots are gone. Then all of a sudden in a couple days or a week or two, those spots come back, but even darker. This is because they're irritated, and now you have a post-inflammatory response, again leading to more pigment and again hyperpigmentation. Now let's get into the different treatment options we have to treat hyperpigmentation. Again, whether it be post-inflammatory hyperpigmentation, melasma, or sunspots. I'm going to go from the most innocuous to the most invasive types of treatments. I like to break it down first into different types of topicals. A lot of times these comprise of different types of acids. Azelaic acid, vitamin C, which is ascorbic acid, kojic acid, or you could use niacinamide or hydroquinone. These are topical products that you can use on your skin to help regulate the melanin synthesis and the color and the pigmentation. The next step up would be a chemical peel. To be honest with you, a lot of chemical peels incorporate these same types of acids, and all you're really doing is you're using something stronger to basically break or penetrate that outer layer of the skin so that the acids can get better access to the melanocytes and the melanin to kind of help break it up and regulate it. As we move down in terms of, or move up in terms of invasiveness, the next would be some type of dermabrasion, where you're physically applying something and removing the very, very superficial layers of your skin. This can be very helpful, especially for sunspots, which tend to be superficial. But the problem lies where you have pigmentation that lies deeper, and this is where you would use kind of the more invasive modality, which would be some type of laser. Lasers come in all shapes and sizes and different flavors, so to speak. So you have to be really careful. But the whole point of using a laser is to use that energy very focally on the actual area of pigmentation or color on your face or your skin to really help penetrate and break up that pigment itself. Lastly, something that I forgot to mention with regards to treatments for hyperpigmentation would be prescription strength medications. These typically come in the form of retinoids. These are topically applied, but you need to make sure to consult your dermatologist to make sure it's right for you and you have the right prescription. Of course, the way I see it, prevention is just as effective as actually treating or trying to correct something. So if we can do things that are pretty simple to prevent us from getting sunspots, things that we can do to help control our melasma, or things to do to prevent post-inflammatory hyperpigmentation, these are things that we should do. Basic things, use a basic sunscreen, right? We know that the sun, which is great, feels warm, gives us that nice tan, also activates and upregulates the melanocytes. That's going to cause sunspots. That can cause worsening of your melasma. If you have some type of post-inflammatory hyperpigmentation, you're supposed to stay out of the sun because it aggravates it and reactivates it. Another very easy and effective way to prevent pigmentation of all sorts is to have a good skincare routine. And really what you want is you want something that in terms of a cleanser that may be using some of these types of acids or some of these types of materials to really help control those melanocytes, which are responsible for creating the color and the pigment in your skin. One easy thing that we can incorporate into our routine, specifically our skincare routine when we're talking about our moisturizers, is to use products that have antioxidants, whether it be vitamin C or any other antioxidant. This can really help reduce free radical formation in our skin, which may negatively affect the regulation of those cells that cause the pigment. So if you sum it all up and you can incorporate all these things into your skincare routine to help prevent it, or if you're already past that and you need some type of treatment, you can use all those modalities together. I often get questions asked about hyperpigmentation, so let's go over some of the most common questions that I encounter pretty much on a daily basis. So one question that I encounter pretty much all the time is, if I have hyperpigmentation, can I just leave it alone and will it go away? That's a tricky question and a tricky answer because it's yes and no. Sometimes it can go away, but in reality, most of the patients I see are adults. So in that case, unfortunately over time, the pigmentation persists or actually gets worse over time. So this is a perfect time to intervene and use one of those strategies that we talked about to treat the hyperpigmentation, but then also an opportune time to start incorporating things to prevent further hyperpigmentation. A second common question that I get asked all the time, especially in this day and age where we're trying to prevent everything and we're all looking about wellness, is diet. How does diet affect pigmentation? Are there certain things that can directly or indirectly affect pigmentation? To be honest, the literature and the data is still kind of sketchy out there. There isn't anything that really shows a causality between certain foods. But in general, maintaining a well-balanced diet, rich in antioxidants, lean meats and proteins, that's always a good way to start. The third question I get most often is, okay, I have this spot on my face. Can you help me get rid of it and will it come back, right? So it really depends on what the cause of the pigmentation is. If it's something like a sunspot, using those modalities that we talked about, whether it's a chemical peel or dermabrasion or using a gentle laser, you can effectively remove that type of pigmentation. If it's something like melasma, that's gonna be very difficult. Melasma, in essence, is probably the toughest, most difficult type of pigmentation to treat. The way we look at melasma as professionals, it's something that you want to help control. You want to help minimize. So there's, again, those things that we can do to minimize the activity of those cells, to keep that melasma at bay, and again, to prevent or minimize the appearance of the pigmentation. Hyperpigmentation can be very frustrating, and it's a very, very common condition that affects everyone, myself included. But if you come up with a good routine and partner with the right provider, it's something that's very treatable, very manageable, and preventable, right? So if you incorporate all those things, you can really help get it under control. If you found this video helpful, make sure to hit the like and subscribe button. And if you have any specific questions related to your pigmentation issues, feel free to leave them in the comment section and I'll be happy to get back to you. Thanks for watching.